first one in black, it's going to be your regular insulin. When you give insulin, so you give regular insulin right here, it goes up, peaks, and then it comes down, right? But this is what I wanted to emphasize, because I know this says nothing. It starts increasing within 30 to 60 minutes. That's when the insulin begins to work. This is your regular insulin, by the way, okay?
Okay.
And then it reaches its peak time, which is, again, you see right there, it's at level 10, within 2 to 4 hours after the insulin has been given.
Okay.
And then, of course, the duration is about 8 hours. So this is what I mean. This is what you really want to focus on when you're looking at insulin injections. You want to look at the onset time, when the insulin begins to work, because that's when you're going to give your patient his or her food.
Okay.
But you're not really concerned about hypoglycemic events, meaning that the blood sugar might drop dramatically, because that's going to happen during your peak time. The peak time is what you really have to know. That's when you have to go back and look at the patient again. So you have to know the peak time of all of your insulin, so you know when to check on the patient again, because since it's working at level 10, well, yeah, the blood sugar may be dropped significantly, and you may develop hypoglycemia and pass out. Does that make sense?
Yeah.
Okay. Now that's NPH. Now in red, I'm going to describe your Lispro and your Aspart. But let me erase some of this stuff first. So you know this is time, so I'm just going to get rid of this. Now, your Aspart, Lispro, these medications they work a lot faster, but they don't last as long. So let's say you give it here, and you have your Aspart, Lispro that goes up and then down. You see how the peak time is going to be a little bit before the regular insulin peak time?
Yeah.
And so your onset time is, again, when it begins to work, that's about 15 minutes.
Oh, wow.
And 15 to 30 minutes is what the book says, right? Now, your peak time is 60 to 90 minutes. So an hour and a half after you give it. So for those medications, for those insulins, that's Aspart, Lispro, you have to check on your patient within an hour to an hour and a half after you gave it, because the patient might drop their blood sugar significantly during that time frame. Does that make sense?
Yeah.
All right, cool. And duration is like 5 or 6 hours, something like that. Okay. And then we have another one. Let's do it with purple. Let's say that you get, whoops. Let's say that you gave, what's it called? NPH. NPH is a cloudy one, okay? This is an intermediate acting. So you give it here. Now, this one's a little bit different. This one's a little... You see, so the onset for NPH is about 2 to 4 hours. It takes about 2 to 4 hours for the medication to begin to work. And then its peak time is usually 6 to 8 hours. Some books say up to 10 hours. That's when the peak time is. So if you gave NPH at 12 p.m., you would have to check on them at 6 or 8 p.m. for a hypoglycemic event. Does that make sense?
Yeah.
And we have, and remember, NPH is cloudy. You need to know that that's the only cloudy one, okay? All the rest of them are clear. And so if you know that information, you could eliminate some of the incorrect answers in a little bit, right? But anyway, and then you have the last one, which is Glargine, or your Lantus. Let me put that as yellow. And so you gave that here, and it kind of goes like this.
What level is that?
What was that? What do you mean, what level? Oh, this is like at level 3. It doesn't, there's no peak time for this one. You notice that there's no peak time? This is just to keep the blood sugar steady during nighttime while your blood sugar may go up a little bit. So these are the 4 basic types of insulins, right? We discussed your Aspart, Lispro here. We discussed your regular, put R for regular. We discussed your NPH, which is the cloudy one. And then we discuss your Glargine, which is the one that has no peak time. And that lasts up to 24 hours.